So today we're going to be discussing fall prevention as well as the benefits of strength training with age. To give a little bit of today's overview, we're going to start by defining falls, so the what, how, and why, as well as fall-associated risk factors. We'll then talk about the consequences and complications associated with falls, and then talking about the three main factors of fall prevention. We'll discuss how we can address these factors, and then wrap things up by discussing the additional benefits of strength training with age. So in terms of defining a fall, what a fall is when you slip, trip, or fall suddenly onto the ground or floor. And these occur due to a loss of balance and an inability to recover balance. Now, as for why falls occur, this is due to a complex set of conditions and circumstances which lead to the loss of balance. Now, these conditions are what we term fall-related risk factors. So taking a look at fall-associated risk factors, they can be biological, such as muscle weakness, our general health and well-being, or age. They can also be behavioral, and this can include a fear of falling, poor nutrition, lack of physical activity, or taking multiple medications. They can be environmental factors, such as home hazards. With this, we look at broken steps, throw rugs, or clutter. Or they can be social, which can include income, education, housing, and social connectedness. Now, the good news is that falls can be prevented. So there are four main systems that work together to control balance and prevent falling. These are visual, vestibular, somatosensory, and the musculoskeletal systems. We'll dive into these a little bit deeper later when we discuss the three main factors of fall prevention. But in the meantime, why do we care? Why do we care about fall prevention? So it's important to understand the risks and consequences associated with falls and higher fall risk. Taking a look at a few of the statistics here, 37% of falls can lead to a minor injury, 10 to 15% a fracture, and 5% a severe injury, such as head trauma. So we commonly see individuals who have endured a fall-related fracture and the associated consequences, and these can have a major impact on our well-being. Here I've noted the three most common fractures we see as a result of a fall, which are the hip, wrist, and pelvis, and I've noted a few of the consequences associated with each of these. Starting with a hip fracture, we see reduced independence. Many who incur a hip fracture are unable to regain the ability to live independently, and approximately 1 in 4 will require admission to long-term care. There is also muscle loss from decreased use and difficulty walking. This consequence is particularly important to note, as a decrease in muscle can lead to the further risk of falls. Mental deterioration due to a variety of factors can occur, including being unable to partake in previous activities. We may also see non-union, so the improper healing of bones, as well as death. Now, this is a scary one. However, it is important to note that about 20% of patients will die within a year of hip fracture. Moving into a broken wrist, there's a high risk of infection from the surgery as well as the long-term recovery. There's a chance for potential nerve damage, which could lead to numbness in the fingers, and we also see the development of arthritis and carpal tunnel quite often following a wrist fracture. Now, moving into the pelvis, there can be some quite severe complications associated with a pelvis fracture, and this can include severe bleeding and organ damage. There's also a high probability of chronic pain and reduced mobility, both throughout and following the healing process. Now, a pelvic fracture can also lead to psychological distress due to the long recovery period and the lasting effects of the fracture. With that being said, studies do show that people report significantly lower quality of life, both mentally and physically, for up to 2 years following treatment for pelvic injuries. So now that we've covered the facts and consequences of falls, let's focus on what we can do about this and take a look at falls prevention. So the three big factors of fall prevention are our vestibular system, muscle strength, power, and mass, and our coordination and reflexes. First, taking a look at our vestibular system. This is our system located in the inner ear, which coordinates with the brain to help us understand where we are positionally in space. So this system does start to decline quite a bit earlier than we would think, right around the age of 40. Now, it's really important to maintain the health of the vestibular system for fall prevention, and things that we would do to help with this is include regular physical activity and balance training into our day-to-day life. Now, doing a quick activity to test our balance here, I want everybody to stand on up, and we'll try a couple balance stances. So the first one I'd like everyone to try is standing with one foot right in front of the other. So we'll step one foot up, and the heel from the next foot is going to be right in front of that one. So almost as if you're walking on a tightrope, and trying to balance there for about 30 seconds. Now you can do this in your own time at home. And the other exercise that we'll be trying is balancing on one leg. So be sure to try these standing near a wall or a chair, anything that can help you holding onto your balance there. Okay, so we'll move on from this activity and we'll take a look at muscle mass, strength, and power. So just starting off by defining what exactly these are. Our muscle mass refers to the size of our muscles, whereas our strength refers to our ability to generate force. Now, power differs a little bit slightly, as this is our ability to generate force quickly. So some examples of powerful movements can include pitching or swinging a baseball bat, where we want to generate that force quite quickly for the desired outcome. So another quick activity to test our lower body strength is going to be working on a sit to stand. So starting from a seated position, we're going to try to stand up without using our arms. So hands can be out in front of you, across the chest, on your hips, whatever works, as long as we're not pushing off of our legs or the armrest to go from sitting to standing. From standing here, I'll see how well we can control sitting slowly back down into the chair. So it's just as it sounds, we're going from sitting to standing and back down to sitting. So a little bit more about muscle mass, strength, and power. We're going to look at some statistics here. So I love looking at the numbers as they do give us a clear picture of what's going on. Now, with that being said, there will be some variability since it is the human body and we all are just a little bit different. But generally speaking, muscle mass, strength, and power is something that we want to act on sooner rather than later as we start losing muscle after the age of 30. Now, on average, we initially lose muscle at a slower pace of approximately 3 to 5% per decade, but after 60 years of age, this loss does start to rapidly increase. Now, to put some of these statistics into perspective, I did want to discuss sarcopenia. Now, sarcopenia is a musculoskeletal disease in which muscle mass, strength, and performance are significantly compromised with age. So essentially a very fancy word for saying you have sustained a significant amount of muscle loss. Now, it's estimated that about 10 to 20% of older adults have been formally diagnosed with sarcopenia. 10 to 20% it may sound small, however, the vast majority of individuals are not formally diagnosed. So the prevalence of sarcopenia in the population is actually much higher. Now, one last thing to note about some of the statistics here is that we do see up to a 5% decrease in muscle strength per year after the age of 40. So in terms of how our muscles can affect fall risk, we see that declining muscle mass, strength, power, and physical performance are independent contributing factors to increased fear of falling, while declines in muscle mass and physical performance can contribute to the deterioration of overall quality of life. So our muscles do have quite a significant impact on our ability to control our movement and lessen the likelihood of having a fall. With that being said, how do we go about maintaining this? It's important to strength train about 3 to 4 times weekly, focused on the major muscle groups to help maintain all of our muscle mass, strength, and power. So before we hop into our third factor here, I wanted to do one last activity to test our coordination. So with this, we're going to be trying the pinky thumb challenge. So I'll have you start by bringing both of your hands up in front of you in fists, palms facing towards you. You're going to start by extending your thumb on one hand and pinky on the other hand. Doesn't matter which way we start. From here, what we're going to do is try and switch. So we're going to switch to thumb on the other hand and pinky on the other hand. And here I'll have you try and switch back and forth a few times as fast as you can, seeing how well your coordination is. Once you've had a chance to give that a go, we'll continue on with the workshop here. So talking about that third factor, our coordination and reflexes. Now, unfortunately, these also do start to decline quite early, between the ages of 40 and 50. Our coordination can help reduce the risk of tripping or misstepping by having a smoother gait or being better able to maneuver, such as making quick turns. In terms of maintaining our coordination and reflexes, again, we look at regular physical activity, which can include strength training, agility, and aerobic activity. So, with how far we've come, what's the consensus? From what we've covered today, we can see that strength training is a key factor in fall prevention as it targets all three variables: our muscle mass, strength and power, our coordination and reflexes, and our vestibular system. Now, I wanted to take a look at some of the other benefits of strength training that may not be as obvious or commonly known. So some additional benefits can include a reduced risk of chronic conditions, improved cognitive function, confidence, and mood, improved balance and stability, improved bone health, including density, increased muscle strength and mass, as we've discussed, and a few other things, as this is not a comprehensive list, but merely just some of the additional benefits that we see that most closely pertain to what we've discussed today. So we see that strength training can be a crucial step in what we call preventative or proactive healthcare, which focuses on the actionable steps to try and prevent illness or injury. There are a large variety of areas in our lives in which we can work on preventative care. Seeing how strength training can have various positive influences on our health and well-being, it's important to incorporate sooner rather than later to allow it to serve as a preventative approach to our health. Now, this is not only for fall prevention, but also for overall well-being, as we've just discussed some of the other benefits. So at this point, we've determined that pretty much anyone and everyone should incorporate some form of strength training into their life. And this is where we commonly start to hear some of the following. So I don't know where to start. I don't know what I'm doing. What if I hurt myself? Similar variations to these statements and questions, we hear them all, and it's entirely valid. We want to approach strength training in the safest and most effective way possible. Now, it's challenging to know what to do and how to ensure that you're doing it properly. This is where working with a kinesiologist can come in handy. While working with a kinesiologist, you can get an individual exercise program with coaching with your unique outcomes in mind to help you take an active approach in your well-being. This is my overall key point for the evening, and I hope this is what everyone takes away from this workshop, is that it is key to focus on preventative care rather than reactive, as it has much more effective outcomes. A few last things I wanted to cover is that we do have an upcoming class running out of our Sterling Center location. So this is going to be a small circuit-based group fitness class focused on strength training. It's going to be welcome to all levels of fitness and all levels of experience. It's going to run for 8 weeks, starting on Tuesday, January 21st, running until Thursday, March 13th. And it'll be Tuesday and Thursday evenings at 5:15 p.m. Wrapping up a couple last things here. If you ever have any questions on anything we talked about tonight, whether it be about falls, strength training, or other things that a kinesiologist may be able to help you with, feel free to give us a call at the clinic, and we can set up a Talk 15 with myself, which is just a nice little phone call where I can answer any of your questions. Also, for those who have attended tonight's webinar, I will be giving out a free session based on those who were attending tonight, so check your email shortly and you may get an email from me. And lastly, we'll also be providing an exercise handout for those who attended tonight. It's going to have a mix of a few balance exercises just to be working on at home to help with your fall prevention. All right, that's everything for today. Thanks.